Welcome to the Medical Collective, your go-to podcast where medicine meets real life. I'm Dr. Keisha Davis, a pathologist, personal trainer, and your host. I will be joined by a vibrant team of doctors who are not just healthcare professionals, but artists, fitness enthusiasts, and advocates for change. Each episode, we dive deep into the world of medicine, from untold stories of the healthcare industry to the latest in medical advancements. We're here to bring your insights, answer your burning questions, and explore the art and science of healing. So let's get started and step into the world of the Medical Collective. Welcome, everybody, to another episode of the Medical Collective. I'm your host, Dr. Keisha Davis, and I have my co-host, Dr. Sharon, with me. This is a special episode. We have a special guest, Nicole Martin. She's a legal program director of the Autopsy Initiative, and that's the Colin Kaepernick Autopsy Initiative that's part of the Know Your Rights camp. And we'll get into that in just a minute. But I hope you guys are ready to be informed about this because I believe always that the autopsy is the death story. So this is helping families. Welcome, Nicole. How are you doing?
I'm doing amazing. Thanks so much for having me. I'm glad we're back in another space to be able to talk about this work. So I'm very appreciative.
I know. For those that don't know, we used to be on another social audio app during the pandemic, and I met Nicole during that time. So I'm glad she's back to have this in our home, our Medical Collective home. How about you introduce yourself and tell people about you?
Absolutely. So my name is Nicole Martin. I'm an attorney, and I was the first employee of the Know Your Rights Camp Autopsy Initiative. So I've been here about 4.5 years now, and this has been my first full-time role out of law school, and my job was to make Colin's vision come to life. Colin wanted to be able to provide transparency and objectivity within the autopsy process, and also wanted to provide support for families who have experienced a tragic loss of an in-custody death. So I was tasked with building out our protocols, creating our pathologist team, creating our internal team, our procedures, and assisting the families that we've done through our initiative today.
I love it. What really initiated the movement for the Autopsy Initiative?
Yeah, so I would say this is 100% would be Colin's idea. And so Colin was speaking with his attorney, Ben, and he was explaining how difficult it was to be able to obtain a private autopsy. And so he's done some civil rights cases, for example, and was explaining the challenges that a lot of attorneys face in even being able to take on a police-related death case or in-custody death case because obtaining a private autopsy was so expensive. So then Colin decided, well, how about we alleviate that financial burden for families? And so autopsies, obtaining a second private autopsy is extremely expensive. And so we provide this service free for the families, but we pay our pathologists and the participating funeral homes. So our average cost of an autopsy through our program is about $13,600. And so Colin wanted to alleviate that financial burden because he didn't believe that families should have to pay an astronomical price to find out what happened to their loved one. And within that piece about providing that financial burden, alleviating that financial burden, it was also providing that objectivity and transparency. So he was very adamant on us building our own independent forensic pathologist panel. And so we perform these second autopsies independent of the state medical examiners or coroner's office. So these autopsies are entirely independent. And so that's where the objectivity and transparency comes in. So it's kind of those balancing needs of wanting to support the families who are grieving a difficult loss during that time and to really be able to provide them with the truth. So that was Colin's vision, and it was my job to then create our program to build that into life, which we have done since 2022, as you mentioned.
And something that you said, Nicole, was about transparency, and providing a source for family members. As a pathologist, I completely understand what a second review can do. And none of us would be hurt if someone asked for a second opinion on a case, right? Even a clinician, someone asking for a second opinion. But when it becomes to a legal battle, the second opinion, right, can make or break a case. And so I don't know if family members understand that one, it's very important to be able to get that second autopsy. And two, that you guys are going to be a resource for that.
Yes, Yeah, so I think that going to that objectivity and transparency, as you mentioned, in any type of medicine or medical opinion, it always does help to have that second opinion. And that's what we're here to do, is to provide a second look on the first autopsy that was done and to do the best that we can to be able to provide the family with a definitive cause of death diagnosis.
Dr. Sharon, you have any thoughts on that?
Yes, I definitely think you guys are, not think, I actually definitely know that you guys are serving the community really well. Because a lot of times the loved ones don't have that money for our second opinion and second autopsy, someone, an independent reviewer. So their loved ones are buried, or whatever's the remains, without sometimes even closure, without really knowing what happened. And all they have to go by is a one-sided story of, my loved one died in someone's custody, but I don't know what the truth is. And I cannot imagine having to live with those questions really for the rest of your life. Right? So I definitely know that you guys are doing such a great job to help the community and help people in need. So thank you.
No, we greatly appreciate it. So far, since we launched our program, we have provided 124 free second autopsies through our program. And so we're very grateful for the families that we've been able to assist. But unfortunately, we know that this is happening at a much higher rate than the cases that we have been able to assist with. So that's why it's so special for us to be here today to really spread the word and awareness about our services.
And I agree. I have seen on social media and so many times as a pathologist that people do not truly know, first of all, what the autopsy does, which is the death story to me. And in addition to that, what a forensic pathologist for everybody is a specialized pathologist. I am an APCP pathologist, but a forensic pathologist, after they do all of this residency, they specialize just in forensics, like I specialize in cytopathology. So they specialize in forensics. And the death story overturns not just legal cases, but makes decisions on the width of the slats in a crib, makes decisions on why seatbelts are needed based on the findings of people unaliving from these situations. So it's so important what forensic pathologists do, truly, and that you all are utilizing the resource for the better good. Now, I want to talk about why now these services are needed, because people assume you have an autopsy. Why do we need to have an independent service to do it? What are like the biggest gaps that you're seeing in standard autopsy processes?
Yeah, I think when we talk about the gaps in the autopsy process, there are a lot of issues that are occurring within the first autopsy. I think some of those can be potential bias done within the first autopsy process. Specifically, for example, in some police-related death cases, the officers who were involved in the death might be present in the autopsy room. So that can have that other perceived issue of bias there, for example. I think other times when we talk about discrepancies, we've seen differences in reporting between the first and second autopsy report. We've seen at least 3 times where a family was told that a second autopsy was completed, and then we found out that there was no autopsy done at all. So our second autopsy ended up being the first autopsy because the family was lied to. So when we talk about gaps, there are discrepancies, but there's also complete falsehoods of what's being told to the families, of things just not occurring. We've also seen cases where the cause of death from the first autopsy is ruled as a natural cause, and then the cause of death in the second autopsy reveals that it was not a natural cause, but could have been due to something else. We've seen issues where someone has been strangled or beaten, and injuries that were found in the second autopsy was not present in the first autopsy. So within those issues that we've seen in the small subset of cases that we've done, it raises a concern to the whole system of the autopsies that are currently being conducted, and showing the importance of why having that second opinion is always helpful.
I agree. And it's sad that it's come to this, because when you see discrepancies like this, that's when we start to have distrust already in the medical field. And then even in pathology, that's supposed to be the bare bones of diagnosis. I do have a question, though, about some of the challenges. When you're trying to keep, because there's some like sensations, some things in the news that are happening, and you have to keep this confidential. First of all, y'all, there are privacy. There's HIPAA. And a family is grieving right now. And I know a lot of people on social media want to be the first one to break a story, and then they break it, wrong or say things that are not true. So what are some of the challenges you see with keeping all of this confidential?
Yeah, I think the confidentiality of the family is our top priority. When we're dealing with these cases, they are very sensitive cases and sensitive issues. These are families going through the peak moments of their grief. And so the confidentiality of the families and preserving that is one of our biggest priorities through the initiative. Because something that we wanted to do is build trust with our families. And that's have been a top priority since we created the program. A lot of the times the families don't know who to trust in this situation. They're thinking that who they could have trusted initially with conducting the autopsy report or the officers involved, for example, that they could trust them, and they find out that that's not the case. So we spend a lot of time on building that trust and creating a support system for families through our program. So the confidentiality is extremely, extremely important. And we've also done, as you mentioned, some very high-profile cases, whether they're high-profile nationwide or if they are also high-profile in that community as well, too. But something that we always clarify is that regardless of whether it's high profile or not, each family deserves to be able to have the truth about how their loved one passed away. And so we take each family that we serve very, very seriously. And we also want to create an open form of communication with them. And so we also have 3 services essentially that we provide. The first is that independent second autopsy. The second is a disclosure of the preliminary findings. And so that's a portion where confidentiality is important as well, too, because what we've noticed in these in-custody death cases and police-related death cases is oftentimes it can take the families between 6 to 8 months before they hear anything about the cause of death. They might not obtain that report for months. And so what we did differently is within 3 weeks after the second autopsy has been completed, we will allow the family member and their attorney, if they have one, to speak directly with that pathologist for a preliminary findings discussion. We found that to be extremely valuable because they don't have that information previously, and it gives a chance to have that open dialogue. And so in that finding, we emphasize how these findings at that time are very confidential because they don't have the additional evidence yet. So they don't have the body cam footage, the eyewitness photos, the autopsy photos, the first autopsy report. So at that stage, at the preliminary findings discussion, the pathologist can't definitively say this is what the cause of death is. And so that's why it's so important to have that confidentiality to make sure that our pathologists have all the supporting and relevant evidence to determining what that cause of death is before making any statements or before making any conclusions about what the cause of death is. We want our pathologists to have as much information as possible because our goal is to get the truth. And for us to be able to get the truth, they need to have all of the relevant information. That can also include medical records and jail records, which in these cases can take a long time to get. So it is a process.
And it's not a process that happens overnight, everybody. I can say as a pathologist, the longest cases that we encountered were forensic cases. What we see under the microscope and what we see at the time of the autopsy is one thing, but what information we gather all has to be sifted together to get the story. It's the same thing with the diagnosis. You can't make a diagnosis without the clinical presentation. You just can't make it. And it does not happen in a couple of days or hours, right? Or even a week. It's multiple weeks. So if you do see stuff coming out about a high-profile case that just got, whether or not it's true, just got taken by the Autopsy Initiative, the second autopsy is not going to be done that fast. And it's not going to be Joe Schmo on social media that's going to be rendering that information first. It's going to be coming from the legal representation right first. They're going to release a statement. So I think all of us also need to do our part by not spreading rumors and consider the source.
Yes, absolutely. And as far as just the autopsies and time frame, so we're trying to complete the second autopsy as soon as possible after that first autopsy has occurred. So our cases are very, very time sensitive. And so that's why within having that preliminary findings discussion so early after the autopsy has been so valuable. And a lot of families have told us that they can begin their grieving process once they've been able to have more information about what happened to their loved one. Having that discussion allows the family to ask questions about any injuries or lack of injuries. It asks them to give their input into what they think could have happened or concerns that they've had. And it gives the pathologist the opportunity to share what their findings are. But it's very important, and I appreciate you bringing that up, that we want to always make sure that all the evidence has been provided before we say definitively what the cause of death is. So it's something that we have to be aware of. But the reasoning for that is that we want to, again, get to the closest definitive cause of death determination. So thank you very much for bringing that point up.
And one other point I want to bring up, and then I think Dr. Sharon may have a question for you, is about your autopsy initiative. The autopsy initiative is not taking all deaths, unfortunately, of family members, right? Specifically those questionable deaths that happened under police custody. And that includes, and let me know if I'm wrong, that includes in the pursuit, that's when you're in custody, in the pursuit, the chasing of, and even withholding medical care, and we'll talk about that later, in jail.
Absolutely. Yes. So our in-custody death determination, we wanted to have a broad category to encompass a variety of those type of deaths. So we do deaths that occur during arrest, during apprehension, during pursuit, and during incarceration. And it doesn't have to just be a police officer. It can be any federal or state agent, for example. So sometimes it may be police, sometimes it may be sheriffs, sometimes it may be a probation officer or someone who works in a jail or prison. Those are all cases that would still qualify within our in-custody death definition, and also cases that occur within ICE detention as well.
Yeah, and we'll talk about that, because the ICE detention, I have some questions about that. Dr. Sharon, up to you.
I just have a curious question. What happens when the community loses trust in the official death investigation or death report? Because, you mentioned that sometimes they said an autopsy was done and it wasn't done, or your findings might differ from, the original autopsy. So what does that mean for the community?
Yeah, I think that it shows, I appreciate the question, but I think it also shows the need, why we need to have that second autopsy. And so when people have asked us what is the goal for our autopsy initiative, I always say our goal is for us to not need the autopsy initiative, for the deaths to not be occurring within the first place. But unfortunately, we are far ways from that. And the truth is, our most realistic goal that we have is that we can serve every family who loses their loved one to an in-custody death. So we want to be able to serve more families, and we have seen some family members obtaining a sense of justice. And I say a sense of justice because nothing will ever bring someone's loved one back. And so I think that if you are a family member who has experienced that type of loss, there's nothing that can be done to rectify the situation. There's nothing that we can do to fully gain hope back, but we have seen some steps in some families obtaining some form of justice. For example, 2 of our cases have settled for $4 million. And we've also seen a Department of Justice investigation into a jail where a death occurred, where someone died due to severe neglect. So I think that those are the things that give us hope, because especially the Department of Justice investigation, something that we're also working on currently is being able to publish our data, because it's important for us to now track if there are certain offices or areas or jails or prisons where people are consistently dying. There should be a check. There should be an investigation, so it prevents other people from dying there. And so I think that there has to be also a balance where we're working together. We need the lawyers to take on these type of cases. They're difficult cases to take on. We also need policy and legislators to change what the laws are currently. We need more accountability when there are gross falsehoods at that point. So it goes beyond negligence. It's falsehoods, it's lies, it's discrepancies, things that shouldn't occur. So I think that we are providing one step, but there's a lot of different players that need to be involved for us to truly get justice for our communities. And I think it's something that at least keeps us going, is that we always try to remain hopeful for more. And some families have told us that we've been a light during their dark time, that we've been able to give them that hope, that they've been able to feel a lot of the families. Something that I've seen kind of very common is the families kind of had an instinct or an intuition that they knew something was wrong, like in those cases where we have seen the discrepancy. So I think it gives the families validation that their intuition was correct. And so I think that it's also important for us to listen to ourselves and listen to our community, listen to our judgments. And if we think something is off or we feel something is off, that's why it's always helpful to get that second opinion, especially when it's not going to cost anything financially. So we urge families who are in this situation where they either don't trust the first autopsy report or they just want to have that second opinion to come through our services, because our primary goal is to get to the truth.
And time is of the essence, too, when this happens, to make sure. You had mentioned injustice. And I'm thinking about the injustices happen right now. They happen in the police force, but they're also happening in ICE custody. And so are you going to also take or consider cases that are involving ICE? And what type have you seen? Or what type are you open to seeing?
Absolutely. So yes, we absolutely are taking cases that occur within ICE detention. I think when we talk about injustices, we've seen a lot of issues currently with ICE, and we're only expecting, unfortunately, these mistreatments and deaths to rise with the way that we've seen things occurring right now. And so it's of a top priority that all people, regardless of our immigration status, can still get the truth about what happened to their loved one. So we have done one case where someone has died in ICE custody, and we do expect to see a significant increase in those cases, unfortunately. Some issues that we have seen within ICE, when there have been ICE detention deaths, is that there's a lot of concern and issues about the notification process to begin with. I think a lot of issues that are occurring within ICE is that a lot of times they're taken and people, their family member, don't know where they're even taken to begin with. And so even they have kind of like a locator system, but speaking with other policy advocates, we've heard that that's not the most accurate. So a lot of times when families are losing their loved ones in ICE custody, a large challenge that they're having is not even knowing where their loved one is, in which facility that there is. There's not a proper communication system. And there's also a lagging on reporting a death when it does occur. So those are some of the barriers and challenges that we do see within some of the ICE detention deaths that we will likely be seeing through our cases. But we absolutely want to help any family who comes to us and completes our request for services in those cases, because we know how important it is, because we know that deaths that are occurring within those facilities need that second opinion.
And isn't there legally a time frame by which you have to report a death?
Yeah, so there is. And from the conversations we've had, a lot of those protocols have not been followed, because there is supposed to be kind of like a protocol and timeline to notify the family, to get their belongings, things of that sort. And we have seen several reports saying otherwise, that is not what's occurring there.
And also withholding medication, withholding medical care is death in custody. And that's illegal.
Yes, that's something that Colin wanted to ensure that we included within our scope, because actually we've done, as I mentioned, 124 cases so far, but I have a couple of data points that I think would be helpful to share from our first 100 cases. And so speaking about those cases, 56% of our first 100 cases occurred in a jail, prison, or detention center. So a little bit more than half have occurred within a jail or prison. Oftentimes, we have seen the medical neglect. We've also seen patients being taken off of medication that they knew that they needed. We've seen just complete negligence on not checking on people who have physical or mental issues. So we've seen a lot of issues, especially in the prison and jail setting as well, and just severe neglect. So that's extremely problematic. 44 of those cases occurred kind of during the arrest or apprehension or pursuit. So I think a lot of times when people hear, in custody death, they're not necessarily thinking that medical neglect would count on that, but it is. They're dying. If they're dying within the prison or jail's custody, that is still a problem, especially when you have certain jails having multiple deaths in a year. And I think when understanding the problem as well, I think we have to also think about how young the average age is of people dying within custody. And so the average age through our cases of our first 100 cases was 35.9, so about 36 years old. And that's a very, very young demographic. About 96 of those were male, 4% female. And as far as our ethnic breakdown, Black or African American was 48% of deaths. White was 20%. Hispanic or Latino was 19%. Two or more races, 3%. And not provided, 7%. And as far as our demographics, we do perform our autopsies nationwide and as far as geographic location. But the states where we had the most requests was number one, California at 26% of our cases, Georgia at 9%, Florida at 8%, and Texas, Minnesota, and Washington at 7%.
I knew Texas was going to be in there.
Yes, we've actually went to a deaths in custody conference in Texas and met with a lot of advocates there, and they were saying how vast the issue of in custody deaths were in Texas.
Wow. So we really need to improve that. Hello, listeners. We want to remind you that you can catch The Medical Collective on all your favorite podcast platforms. That includes Apple, Spotify, and YouTube. Be sure to hit that subscribe button so that you never miss an episode. We're also on Libsyn, and you can find us on all social media platforms as The Medical Collective. Do you have thoughts or questions? Please don't hesitate to reach out. We love hearing from you. Now let's get back to the conversation. What findings from everything you've just talked about do policymakers need to pay attention to?
I think definitely the ones where they're not happening at all. I think that's, and being told that an autopsy was done, I think there's no words for that. I think that if you're telling a family that a cause of death was something based off of what you made up out of thin air, that's highly problematic. And on top of that, it's that where the policy comes in is if you're completely just lying to families about something this critical and important, there should be some type of accountability. You shouldn't be able to just make that type of lie and have no repercussions, no consequences in doing so. So I think that it could be a policy. If you're making, just completely making things up to families, that's problematic. One way one of our pathologists likes to explain some of our discrepancies is that sometimes it also might be a significant difference in forensic protocol that should have been followed. So sometimes it might not necessarily be autopsy 1 and autopsy 2 have a different cause of death. It could be autopsy 1 didn't complete a critical procedure that was necessary. So for example, if someone died due to a neck injury, and there is no dissection of the neck or no analysis of the neck, then how are you properly determining what the cause of death is? So I think that's another issue of policy as well, too. If you're likely to think someone died due to a specific type of injury, for example, and that area is just not analyzed at all, that's, I don't even, negligence is not the word. That's wrong to do. That's like malpractice. So I think that's another area where policy can occur. And I think, too, that it's also when you have something different, I think that there's always going to be, in any type of field, especially in the medical field, there's going to be differences of opinion. But I think it's also looking at what the differences were and were there critical injuries not reported, if there was no blunt force trauma reported, if there were no kind of marks on the neck report. Like there has to be some type of maybe categories of if this is what occurred and this was not checked off or reported at all, because lack of reporting is just as problematic as reporting something different. Because if you didn't report critical things needed to determine the cause of death, that's just as problematic as putting a different cause of death determination. So there's several areas where policy could be involved as when these reporting comes out. And I think that qualified immunity for medical professionals in these cases also has to be looked at as well too. Because if someone can just say that this is their medical opinion and there's no repercussions or consequences behind that, that's very problematic in these cases because it's preventing families from being able to obtain justice. And going back to full circle on why this is needed, we're providing the basis to even bring a lawsuit. A lot of attorneys that we worked with have told us that without our services and without a different or second opinion, they kind of have to rely on that first autopsy report, and they don't even have anything to even bring the case to begin with. So that's why our services are so important.
I agree. Oh my goodness. And I'm thinking about the second autopsy and how if the first autopsy was problematic, that it's just like reporting a physician. A forensic pathologist can be reported to their board if they're not following. There is a board by which all physicians, everybody, has to follow and is governed by. That gave them their certification to practice medicine and practice within a state jurisdiction. So if you're not following that board, anybody has the right to report them to the board. Yeah. Dr. Sharon?
How do you deal with that when you think like a forensic pathologist is not practicing to the standard of care? Do you guys have a system, a protocol? How do you? Because the whole thing is that the community, the public has to be able to even trust you guys that you're following up and you're holding people accountable to the things that they don't want to be accountable to, right?
Well, so our role is solely limited to the autopsy services. As far as accountability, that is where the policymakers are needed and legislation is needed. Something that we have been doing is kind of like tracking the names of the departments from when the autopsies are completed. So that is something that we're thinking about as we're collecting our data and how we're able to effectively share it with policymakers. But our scope of services are provided on the autopsy services. We also do not provide legal services. About half of our family members have an attorney, and about the other half, I would say, don't. Some are interested in pursuing legal action. Some are solely interested in finding out what happened to their loved one. But things that we have done are partnered with organizations such as the NAACP Legal Defense Fund, the National Police Accountability Project. So, for example, if a family member does not have legal representation but would like to obtain a referral, we do have referrals for legal services that we can give out, but we cannot directly provide any type of legal services or get involved in the case itself because there would be a conflict of interest with the engagement, and we want to make sure that we're remaining objective as well, too.
I was just going to ask about what collaborations and partnerships have helped strengthen the Autopsy Initiative.
Yeah, I think definitely those two that I just mentioned as well, too. I think that we've also partnered with different universities. We partnered with USC's kind of Agents of Change, and we've had about 8 interns, I believe, that they started kind of our first internship program with USC. We've also had a student from Cal State Fullerton as well, too. But I think that has been extremely helpful as well. We've also provided consultations through Deloitte, Step Up LA program, where they were able to provide our initiative with kind of free consulting services on how we can grow our forensic pathologist panel, strengthen our funeral home partnerships. That's another major area of partnerships that we've had actively been working on, are partnerships with individual funeral homes. A lot of people don't realize how logistical the autopsy performances being nationwide. And so because we have our own team of forensic pathologists who are licensed in different areas around the country, if someone's death occurred in a state where a pathologist is not licensed, we then have to work with the family selected funeral home to transport them to the state where they're licensed, have the autopsy performed in the pathologist state where they're licensed, embalm them, and then send them back to the family selected funeral home. And so that's why a lot of the costs get so expensive. So we also cover the cost of transportation for the families as well. But that piece of the program presents definitely some challenges when we think of kind of like logistic wise there. So it's very critical for us to have partnerships with funeral homes who are willing to assist us with transportation coordination, who are willing to have the capacity to help store them until the autopsy is going to be occurring, and also who allow autopsies to be performed at their facilities. Because some of our doctors also have dual licensures as well. So they might be licensed in more than one state, but they'll still need a funeral home to be able to perform that autopsy there because they still need a place to perform. So we've actively built a lot of funeral home partnerships nationwide. We recently just got back from the National Funeral Directors Association conference in Chicago, and we attended last year as well in New Orleans and made great partnerships there. So I think when we think of the partnerships that we've done, we have done a lot of partnerships on the funeral home side. We've also done a lot of partnerships on the legal side, but we're actively trying to build our forensic pathologist panel. We would love for us to be able to a point where we can have a pathologist in every state, because the transportation, it does take time. It does take coordination. Each state has its own laws regarding transport and permits that are needed. So we would love to be able to have our program more well known in the medical field, so people know about our service and other resources that we can utilize.
Great point. And for all the forensic pathologists, colleagues that are listening, check out the Autopsy Initiative. Reach out to Nicole so that you can be part and help that. We need more pathologists. Definitely. Dr. Sharon, I know you wanted to ask something.
So how have these partnerships improved family support and outcome?
Yeah, I appreciate that question. I think the partnerships have been directly impacting the families. I mean, every partnership, every opportunity, every resource, the goal is to make our program more efficient and better quality of services. We're always been increasing, always willing to grow. So I think, for example, when we're talking about our legal partnerships, it can be very difficult for families to navigate this process on their own without an attorney. Also, that we've seen too, that families who have attorneys also get quicker access to having records, the records that they need to determine the cause of death. So we've seen a lot of those family members who have used kind of some of our legal resources or referrals be able to obtain records more quickly, which can expedite the process. It can be very intimidating and difficult. And oftentimes, if a case may be considered under active investigation, they may be stalled out from being able to get those records. So having an attorney who can advocate for you and fight for you to be able to get those records is extremely helpful. And then to also just be able to kind of navigate some of these challenges and kind of let the family be able to have the time to grieve while the attorney can kind of handle the legal matters and next steps. So we can see that being pretty helpful. When it comes to the funeral home side partnerships, it becomes a lot easier to work with funeral homes who already know what we're trying to do and who have already worked with us. Because when we're working with the family selected funeral home, we are working with whatever funeral home that the family selects. And so they have different levels of experience. They have different levels of capacity and staffing. And if it's not something that they've regularly are done or feel comfortable doing, it's a case we have to consider the family member safety. And so their loved one safety. So we need people who are experienced in doing unembalmed transport. And so that helps having funeral homes who are already doing that, because oftentimes we can be met with a lot of skepticism in general on why a second autopsy is needed. So if we have funeral homes who can understand our mission, understand what we're doing to assist the family, it makes the process go a lot easier. And sometimes if we're working with a funeral home who may have additional questions or need additional support, it helps us having funeral homes that we've worked with to talk funeral home director to funeral home director, just as you can see, kind of talking lawyer to lawyer, doctor to doctor. If you're in that field, it helps a lot to have someone in the work to be able to explain, this is what we're doing, this is why we're doing it. And we've seen that be extremely helpful in navigating some of those conversations. So our goal is to always get that autopsy done as soon as possible. So the quicker that we can get the funeral home on board, get the flight booked, get the transportation set up, it becomes an easier process overall for families.
There's so many different steps to it that I'm sure people don't even realize. And you guys are coordinating all of that, which is great. And I'm sure you also need support, right? Monetary support or people donations. And is that information on the website?
Yes, there's a space to donate on our Know Your Rights Camp website. Yes, we have been very grateful for all the donations that we've received because all of our costs have been funded solely through donors. We do have a fiscal sponsor, the Entertainment Industry Foundation, but we are all donor funded. So all of the autopsies that we have been able to complete have came from the help of very generous donors. So that is how our program operates and runs. And so unfortunately, we know that these cases are increasing. And so we do expect, and as more people find out about our services, we do expect to continue being able to provide our services and expanding the scope of our program. So I appreciate that question.
Thank you. Okay, I have some true or false for you.
Okay.
And this is to see if the audience is paying attention, because I'm sure we can answer these questions. All right. Families must accept the first autopsy report they receive. I'm going to ask Dr. Sharon.
Absolutely
a family
false.
You're winning. Yes. You are afforded the right to have a second autopsy. Unfortunately, in this day and age, right, it's mostly people that have the big pockets, but now we have the big pockets in the Autopsy Initiative to help. All right, this is for you, Nicole. Medical examiners must release full records to the next of kin in every state.
That is false. It's definitely going to vary by state to state. And also what they are going to release, as we mentioned, it can be limited and it can also be significantly delayed. There are some family members who may never receive the records that they need. Or sometimes if they're told it's under active investigation, there's significant delays on getting that report out. So that is definitely false.
Wow, I did not even know that. All right, Dr. Sharon, autopsies always reveal the full truth because we're the godfather, we're the pathologist.
No, the autopsy might reveal some truths, but it doesn't necessarily reveal all the truths. Sometimes you may not even be able to find an answer, from an autopsy. And I understand that's daunting, but yeah, that's not a 100% true answer.
Very true. I remember my first case in residency going with a forensic pathologist to a case and this was all public on TV, and there were two experts, and they were saying, right, that this was shaken baby based on the Purkinje, based on seeing these fibers. And one was saying this and one was saying that. And they were literally going down to that, right? But clinical context really matters, what was happening at the home, all of that. And sometimes we can't give you the answer to make or break a decision. Okay, next one. Independent autopsies are only for legal cases.
False again. As we mentioned before, some of our families have attorneys and want to pursue legal action. Some of them don't, but it doesn't take away or negate the fact that everyone deserves to have the right to the truth, regardless of whether you intend to pursue legal action or not.
All right. Okay, last one. Families cannot question or request clarification on a medical examiner's findings.
This is the biggest false yet. This is why we're here today, to explain why our services are needed. You absolutely do have the right to a second autopsy. You have the right to ask questions. You have the right to, again, trust your intuition when you have a gut feeling that something may be left out or something might not be correct. It is your right to be able to ask those questions. And it's also your right to get that second opinion. And it's your right to know your rights at Know Your Rights Camp and get an autopsy through our services.
Thank you so much. Dr. Sharon, do you have any final questions for Nicole?
I do. As a part of your partnership, do you have or do you refer the families to grief counseling services that will help them get through this? Because I cannot imagine how difficult this is and such an emotional roller coaster for the families, especially when you have questions. How did my loved one, die in custody, or you're not getting a straight answer and you're getting the runaround, or even just the wait time. Even just the wait time of, okay, the unknown, right? Do you have a partnership, a network of counselors, grief counselors, therapists that, that you refer, the families to?
Yeah, I appreciate that question. I think that going through the grief of this type of loss is one of the biggest challenges as well too, on top of having that grief while not knowing. That makes it 10 times more difficult to be able to go through that process. So we have talked to other community organizations based kind of locally when a death has occurred, and we have some resources there kind of state by state, but we're always open to further partnerships on other resources that we can refer to families as well. We've also done some meetings and webinars and panels with kind of families, like kind of group of advocates of family members who have lost their loved ones due to an in-custody death. So oftentimes, we've seen a lot of mothers coming together on this type of loss who have shared common losses of losing their loved one due to a police-related death or in-custody death. And we've seen how they've been able to kind of assist within the process of this is what you need to do. Or we've even talked to families who have helped other families in navigating the media during these times, especially when, as you mentioned, taking a high-profile case, it can be very overwhelming for families. So we have worked with other advocates who kind of are able to help families through that stage. And so we've seen it's an unfortunate way to build a community out of grief, but we've also seen how helpful it has been to families who have experienced that. So yes, if anyone listening has any recommendations on further partnerships that we can do or resources that we can give to the families, we're always open because we want to be able to provide the families with as much assistance as possible.
I think that's a great idea. And I think one, too, is also reminding the community, right? A lot of us sometimes get caught up in the sensationalism, is reminding the community there's a family behind it. And if the family says, please, let's not move further with this conversation, respecting them. Because a lot of that pain can be incited. So a lot of it is they're grieving, but everything on social media is making it worse. So, Nicole, I really appreciate you. The Colin Kaepernick Autopsy Initiative, you being the program leader for the legal department, everything seriously. I've been watching you all since 2022, and I'm so proud. Like all these women finding their purpose. And no matter what profession you go into, you can make it your own. And at the end of the day, when you see injustices happen, what can you do to make it better? And you are doing that. Is there anything you want to leave our audience with?
Well, first, just thank you for listening. Thank you for taking an interest in the work that we're doing. Thank you for being involved. Thank you for providing this amazing platform, because I think it's so important for us to be able to have trusted medical information. I think oftentimes it's difficult to figure out who to trust, or sometimes information can be so overwhelming that it's hard to understand. So I think to be able to have this space and platform and break it down into terms that we can all understand is so critical, because our health is so important. It's one of the most valuable things that we can all have. So I appreciate this space. As we mentioned before, we're always looking to partner. Doing this type of work nationwide, we cannot do it alone. We need the help of the audience listening here. We need the community advocates. We need the lawyers. We need the pathologists. We need the funeral homes. We need the therapists. We need the grief counselors. We need to all work together for the good of the families. They're counting on us. The families need us in this state. They've already lost enough. What can we do to provide that support? So I think that something I would leave is that sometimes even a small step can make a big difference. We know that when we talk about injustices, there's so much that we want to change and so much that we want improved, but each little step comes together for a larger goal. So I think it's to never discount the work that you're doing, and even taking the interest and having that passion and having the conversation, sharing the information that you've learned. That's already doing one step. So I think it's asking yourself, how can I do my part? How can I affect and uplift my community? How can I get involved? That would be the last things that I have to say. And again, thank you.
Thank you. And you guys heard the call of action. Ask yourselves, how can you get involved? And sharing is as powerful as any other resource or action you do. Sharing is caring. So share this Medical Collective podcast. Share the Autopsy Initiative. There may be a pathologist you know that may be interested in helping and assisting, a funeral home that may be interested. They're on TikTok Live. I see the funeral homes on TikTok Live. So we'll be able to find some somewhere. So I appreciate you and all the time. And the audience, thank you for listening and joining us. Everything you need to know will be in the show notes. Take care. Thank you for tuning in to the Medical Collective. We hope today's episode has left you with valuable insights and a new perspective on healthcare. Don't forget, follow us on social media for more updates and behind-the-scenes content. I'm Dr. Keisha Davis, and it's been a pleasure to share this time with you. Stay healthy, stay informed, and we'll see you in the next episode, where medicine continues to meet real life. Please note that the content provided in the Medical Collective podcast, including text, graphics, images, and other material, is for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed on this podcast are solely those of the individual authors and guests and do not represent those of the Medical Collective, its staff, and any affiliated entities. The appearance of content on the podcast does not imply an endorsement. Neither the host, Dr. Keisha Davis, the co-host, or any guest of the podcast bear responsibility for the accuracy of the content provided or the use of information received through the podcast. Reliance on any information provided by the Medical Collective podcast, its employees, writers, or guests is solely at your own risk.